that the internal is what's beautiful. That's what's supposed to be beautiful, right? And for me, what's beautiful is how we serve each other.
Ain't no call like a beauty call. Welcome back, everybody, to the Beauty Calls podcast. I'm Dr. Zanis, your host, plastic and reconstructive surgeon here in New Bern, North Carolina. And I'm very excited today to have with me a wonderful guest. This is Nadine Ayala. She is a nationally certified laser operator who is also a master esthetician and expert in all things lasers. I'm fortunate enough to have snagged her and convinced her to come work for us here at our spa. So she's got a lot of valuable insight into the world of lasers and aesthetics in general. So we're really excited to talk with Renova Spa's very own Nadine.
It's fantastic to be here.
Welcome. Thank you for coming.
Thanks for having me.
Thank you for taking some time off your busy clinical schedule to talk about what you do. So I thought that our viewers would be really excited to learn about how the laser technology actually works, because everyone hears about laser hair removal, laser tattoo removal, rejuvenation. There's thousands of different products out there, and we've tried a lot of them out and know that some work great and some don't work so great. So if you don't mind starting off, tell me a little bit first about how you got into lasers and how you've come to predominantly only do laser treatments, predominantly. And then we can talk about kind of the science behind it, or just the basic layman's way of understanding what a laser is actually doing to your skin.
Yeah, that's tough. Breaking down physics in layman's terms.
That's right.
So I started in medicine as a medical assistant and phlebotomist for a while. I would say 15 years.
Mm-hmm.
I was also an EMT practicing in several ERs in Northern Virginia.
Mm-hmm.
I needed a break. I was burnt out. You can probably relate to that. And I met a patient in family medicine who actually was working with the Naval Research Lab.
Uh-huh.
And he's the one who introduced me to lasers. But for the clean energy aspect versus aesthetic, it's completely different. But lasers are lasers. There's different modalities and processes, and for different reasons. But that's where I actually started.
Now, this is all after your military career?
Yes, sir. I started in the Army first. I should back up.
Yeah, you were in the Army. And how long were you in the Army?
3 years. A short stint. I was a petroleum supply and missile specialist. So far cry from what I'm doing now.
Right.
I saw a lot of crazy things.
But no introduction to military lasers at that time.
Yes. With one of the missiles, I can't talk too much about missiles, but one of the missiles is has a smart missile, and it actually has a laser and it can track. So
for tracking purposes. But that's totally different than kind of what we're using laser energy for, which is basically focused light of different spectrums and different wavelengths to accomplish the kind of goals that you're trying to do for your patients. So you got introduced at the Naval Lab?
Naval Research Lab.
Mm-hmm.
Not at the Naval Research Lab, but with a patient who was, his name is Eddie Sines. He has several patents, and he retired from the Naval Research Lab. And he basically cultivated me from a family practice that I was working at and asked me to work for him because he needed an assist. So we had funding from private investors. He was trying to establish his patent at the time, which was a direct energy converter of a type. And I worked for him for about 2.5 years. So
you got a taste of what lasers are.
It was fantastic.
Yeah.
And I really had a passion for that. So unfortunately we lost funding and I had to go back to medicine. And literally one Google search later, lasers and medicine, aesthetic medicine popped up, and I was like, oh my gosh, this is it. This is what I want to do.
Awesome.
Sure.
So you did become first an esthetician.
Yes.
And studied general aesthetics. And how did you like it? How'd you like that field compared to just focusing on lasers? Did you feel limited by what you could accomplish, or are you just looking for a different tool that could get you the results you wanted faster, more aggressively, or all of those wrong?
No, I was incredibly bored at first I was exciting. Okay, everything is exciting when you first start. But I was really missing medicine, and I was really missing laser. And I knew, being an esthetician, there's nothing wrong with it. I think estheticians are awesome. We need estheticians. I love the work. It just wasn't fulfilling for me.
Yeah, I mean, we have 4 estheticians who do the traditional type of stuff, and that field has probably grown a lot since when you were first starting. And estheticians do utilize lasers and other technologies, and radio frequency and stuff, but it's not the mainstay of what you do. Skincare and a lot of the hands-on treatment of people's face, usually.
Exactly.
So, tell us then what in cosmetic lasers is happening with a laser. When you treat the skin with a laser, what are you trying to do?
Well, there's different modalities. There's different lasers for different situations. I explain this to the patients a lot. If you want, a resurfacing, you need a CO2 laser or an erbium laser, which burns the top layer or the epidermis of the skin, versus an ND-YAG for deep hyperpigmentation or darker colored individuals. You're going to treat the dermis, so the bottom layer, up versus the epidermis down. And they do different things. One does laser hair. You want to get down deep with that ND-YAG, reach that follicle, but you can't do that with an erbium or CO2 because it's too superficial.
Yeah, so every laser is going to penetrate to different depth, and that can be dialed in, different depth of the skin depending on where the pathology is that you're treating.
Exactly.
Is it pigment? Is it hair follicle?
Vessels.
So you have to understand all that stuff, vessels,
collagen,
and how they work in a way that will allow you to select the correct laser and the parameters for treating that patient, and how to adjust between person to person, because everyone's skin color is different and texture and coarseness is different. So that must come with experience, I'm assuming.
Absolutely. And I think a good understanding of anatomy and physiology is imperative to be successful in laser. Anyone really can turn a laser on. You can get trained over a weekend. And, anyone can operate the laser. They can be taught to use the laser. They can shoot the laser. They can follow guidelines in a book and do it. But it's basic knowledge, at least, of anatomy, physiology, and physics to really get a good, solid result, a good before and after. And I think that's my edge.
Yeah, I think that's true of any kind of medical field.
Yeah.
Especially in cosmetics. Botox, for example. There's tons of people who want to do Botox, and some of them are nurse injectors like we have, and they're great. Others are not so great, or some are just, different fields. And I'm sure with the lasers, you'll find a lot of maybe estheticians or nurses or other practitioners who say, oh, I want to get a laser and it's going to be amazing and I'll be able to offer all these services, but they have no idea about anatomy and physiology.
Oh, yeah.
And that matters, because you can't really do a good job if you don't know how everything is working beneath the surface of the skin and what you're trying to accomplish, right?
Exactly. And it's dangerous.
Absolutely.
Injectables are dangerous. We have a ton of nerves in our face that can cause paralysis or even worse. Yeah, occlusion with filler. You have lasers where you can burn skin quick, especially if you don't have a good understanding of ethic skin and how that works under a laser, it is a completely different response. There's a lot to know. Again, physics and anatomy and physiology are imperative.
Yep, absolutely. Yeah. And when we were talking about a laser targeting a certain pathology that you're wanting to treat, really what it's targeting is what's called a chromophore, right?
Yes.
So explain to us what some of the different chromophores are that you target and how that works.
There's several different, and there's something called melasma, which a lot of people understand melasma. They know what melasma is. It's the pregnancy mask. It's the brown, typically on the forehead and here. We want to treat that. It's very difficult to treat, especially in the Asian population. For some reason, it's tough.
So that one's the melanin.
Yeah.
In the skin.
Melanin.
Yeah.
That's correct.
And then CO2 will be targeting water.
Water. ND-YAG also focuses on water.
So 2 totally different entities requiring 2 different lasers. And then with tattoos, which is one thing that we really love doing, is helping people eliminate their bad mistakes when it comes to tattoos.
Yeah, guilty.
I think that's constantly evolving, and certainly there's room for improvement in the future. One thing I heard about was the development of special tattoo inks that are more amenable to being broken down by lasers. So they're actually going in with the idea that, hey, you may not want this forever, and so now it'll more easily clear. Have you heard about that?
No, that's fantastic, though.
Yeah, I mean, if that makes sense. It's permanent unless you don't want it to be.
Exactly. Right. And they do use vegetable-based inks in the eyebrows and the lips, the permanent makeup or semi-permanent makeup.
Yeah, so it breaks down a little bit naturally.
Okay. And you've seen those people that got tattooed maybe 2 decades ago.
Yes.
And they have the purple or the green eyebrows.
Very unnatural.
Yeah, it's a look.
So, well, that's really cool. And it's exciting to offer a lot of different technologies every coming couple of years.
Absolutely.
Know, things are constantly changing, as everyone knows. And so let's move away a little bit from the lasers to a related category of non-invasive technologies, radio frequency, because I know you love doing the microneedling with radio frequency.
I do.
The Virtue RF is the one that you use, or the Deep RF. And then also a newly acquired radio frequency machine for skin tightening. So what's all the radio frequency stuff about?
So the benefit of radio frequency without microneedling is skin tightening. That's what you can expect with radio frequency. It's interesting because it's polar or bipolar. And so with some of these procedures that we do, which is kind of scary to the patient, is we have to ground them.
Yeah.
And so that,
protect them.
Right. And so that's something you don't have to do with other lasers, but it's pretty, to me, fascinating.
So is it heating the skin?
It is heating the skin. It's going down to that dermal layer. It heats the skin, the tissue. The ideal tissue temperature is about 42 degrees Celsius. So it's temperature versus dwell time, right? Mm-hmm. So 42 is the temperature you want to reach. It's pretty hot in Fahrenheit. I mean, it hurts.
Yeah.
It's not excruciating, but you can feel that. You're like, oh, okay. Kind of like if you left the load wires on the skin too long.
Yeah.
Yeah, it feels like that, and you want to kind of pull away. But that's the worst of it. And then the longer you keep it there, it's kind of like, and I hate to use this as an analogy, cooking a steak. When you cook a steak, it's kind of soft and mushy, but the longer you cook that steak, it gets more dense. Mm-hmm. It's actually the same concept. It does tighten the skin. The longer you keep it in there, within reason, of course, within scope of practice, the tighter that skin gets.
Yeah. So you're altering the collagen in the skin. And so radio frequency is being used for tightening. Of course, we do tightening by actually lifting the skin and doing surgical procedures. But it's nice to have an option that can actually do some tightening that's not as aggressive, or in someone who's maybe younger or averse to surgery.
Right.
Is that where you're using it more? People who don't really need surgery yet? Or is it just an everyday adjunct to maintain skin tone?
It's different for everybody. I have a lot of, the demographic is older women, and they don't like the laxity it's having to their neck.
Right.
And I'm one of them. Yeah, I've joined that club, unfortunately. And they don't feel comfortable just getting that face or neck lift just yet, or it's affordability. They don't have the social downtime. They have to work. So,
or maybe if they're older, they don't have quite the health that will allow them to go through with any type of a surgical procedure.
That's a great point. Exactly. You have to pass that physical, and if you can't do that, then it's a wonderful option.
I would like that. I'm always for non-invasives if it can work, and that's the rub, because I'm guilty of having been duped into buying expensive machines because the sales rep and people that talk about them and portray it as the next best thing, and then they really don't work, or they don't work enough that it's worth the patient's investment, which then means it's not worth the provider's investment. So I've become very selective in choosing what technology I'm willing to incorporate, because you don't want to waste your money, and you also don't want to waste patients' money, because the last thing that you want is people coming to spend money to feel better about themselves, and it doesn't work, and then they're upset, and then I feel bad because it's a mess. So Can you speak to that at all and trying to discern? Do you just kind of, is it better to be a late adopter and see the proven track record of new machines? Or are you more of someone who likes to jump in and at least try it out and see because you want to be the first to get your hands on it?
That's a great question. I'm super fortunate. I was trained by the top surgeons, I say in the United States, because we lived in the third richest county in the United States. So they get paid a lot of money. So those are great surgeons, right? They're going to be the top.
They have access to things. Yeah.
Exactly. And so I was very fortunate to have exposure to a lot of different modalities. They had basically an endless pocketbook, which it seemed.
Yeah.
So I now have a resource. I can resource those individuals and say, hey, have you done this yet? And that's what I would do first. How is this going, you guys? I still have network in DC, Northern Virginia, West Virginia, and Maryland. And I often reference them. If I have a question, I'll just call or email and text and say, hey, what's going on? Have you guys done this? Daxify is a great example of that. It's a brand new botulism. And I was really like, oh yeah, I don't believe it. It lasts longer, da da da. But I did reference my network up there, and I said, hey, how's Daxify going for you guys? And they're like, oh my God, it's incredible. It's awesome. We're loving it. And so definitely I do my research with real people. You can't depend on the internet. And like you said, those salespeople, they're just trying to make that commission. It's tough.
Yeah, and you have to trust the people you're talking to also, because even amongst colleagues, I was talking to a friend of mine last night, a plastic surgeon, who was recounting how he got sort of not maybe intentionally duped, but kind of sucked into buying technology by another surgeon who it turns out was kind of like on their board of directors and really wanted to promote it and had some undisclosed incentive to sell them. So, sometimes it's not an overt, attempt to trick someone or to delude them,
right.
But if you're incentivized by being affiliated with the product, you're going to want to hype it up and promote it maybe more than it deserves. So it's really hard for us to determine until we've gotten our hands on it and used it. And like Daxify, we've been using it for a couple of months now, and I think it's going to be fantastic. But the only thing I really had to rely on was the FDA studies and their clinical trials, which all seem very promising.
Right.
And there's little to lose from it not living up to what it promises. But it's different if you're making a hundreds of thousands of dollar investment in something that you can't return.
Absolutely.
And it turns out to be a dud. So, and that brings up another thing I'd like to ask you about. I wasn't thinking about it till just right now, but people who do a lot of minimally invasive things usually, or who only do minimally invasive things, are in the fields that are non-surgical. Typically, if that's their focus, it's because they don't operate, right?
Right.
So, lots of different practice settings where there is no surgeon. If you want to help people without being able to do surgery, you can find ways through technology. But the problem that I've found in those settings is that becomes your one and only solution, because it is your one and only solution, and everyone's not a good candidate for that. And I'm thinking about when cool sculpting was a thing, and we offered cool sculpting as well, but everyone who came in did not benefit from cool sculpting, right? So some people I would say no to because they didn't have enough fat, but more people it would be because they had too much fat, or it was in the wrong place. It was visceral, it wasn't superficial. And it's sad to see a lot of patients come after they've had a bad experience where they went somewhere and they said, oh yeah, cool sculpting, give us $5,000, we'll take care of it, and did nothing because they didn't have any other tools.
It's true.
And someone once said, if you're a hammer, all the world is a nail, right? Because everything you see, you're going to solve it with what you know how to do.
Right.
But that's not really the way to practice medicine. It's not really the way to practice any type of aesthetic, offering. So have you experienced anything like that?
Oh, yes. I tell people, first we set that realistic expectation. And even before that, we'll do an interview every single time to see if that person is even a candidate for laser, or would they? I've sent several people to you. They want skin tightening, but they have major festoons, or they're of age, and the laser's really not going to do much for them. They're going to be disappointed. They're not going to be happy. We're not going to be happy, and it's best just to say, you know what, this procedure isn't for you. You're best to see Dr. Zanis for maybe a lower bleph. And they said, oh, what's that? They don't even know that what a lower bleph is. And, comparatively speaking, it's not that much more expensive.
Right.
And it's a permanent result.
Right.
And so oftentimes than not, I'm talking people out of laser and into plastic surgery. It's just more appropriate.
It's appropriate for them. And and I'm doing the same thing in the reverse direction, sending patients to you or to other providers who can do other non-invasive things like injections and things, because they're not quite really in need for a surgery.
Right.
And although if you were to look at it purely financially, sure, you make more money doing surgical things usually than non-surgical, but it's certainly not worth offering the wrong procedure to someone because you're thinking of it in financial terms. That's never the right answer, ethically speaking, but also business-wise. And I talked a little bit with one of our previous guests about that. You end up shooting yourself in the foot if you're thinking first in dollar signs and not in actual patient care. Whereas if you're really focused on what's going to benefit them the most, it ends up doing great for your business because they trust you, they see good results, and they'll come back to you in 10 years when it's time for a facelift.
Exactly. And they'll tell everybody, hey, he was super honest. He told me no.
Yeah.
Or she told me no. And, they could have just done it and took my money and they didn't. And so word of mouth and community is super important. Also just being a good human being.
Right.
Being able to sleep at night.
Do you want to talk about photobiomodulation and what that is? You, I think, really came in with more knowledge about it than I. And when you first joined our practice, talked about the photobiomodulation experience that you had, which I had heard of more called like low-level light or low-level laser therapy. So tell us what that is and what's happening with photobiomodulation. How are you using it now, and what kind of promise do you hold for it as a way to treat people?
Sure. So I was exposed to photobiomodulation, or LLL, or cold laser. So many names for it. It's called cold laser because there was no heat involved. From Dr. Robert Bowen in West Virginia, who is essentially a regenerative medicine doctor, but was in pulmonology his whole entire career, and is also a surgeon. And he told me about a man named James Carroll, who presented to Congress the technology to bring it to light for the opiate epidemic. He was trying to stop that or slow it down or whatever you can do to suppress the epidemic in the United States here, and other countries too. It's just a huge problem.
So hold on, he presented research that he could use lasers to
Congress
to slow down opioid addiction?
Yes, sir. Because it treats pain. It treats inflammation, pain, edema, does soft tissue wound healing over a period of time, of course. And again, with parameters, the appropriate parameters, location, dwell time, temperature, with the magic number or the right ingredient, you could treat those things.
So using a non-pharmacological technique
exactly.
treat the pain will let people wean off of the narcotic.
Absolutely.
How about for people who are narcotic addicts recreationally? What is there any role for that there? Because you're obviously not treating pain.
Maybe for the brain treatment, you can treat the brain with photobiomodulation for depression, PTSD, post trauma like concussions. There's a huge study with football players and soldiers who were affected by multiple concussions, and it showed marked improvement with the use of photobiomodulation. So yes, indirectly, yeah, absolutely.
I've seen some of those studies when you first started talking about it, and I was skeptical because how can one modality treat so many different things effectively, right? Pain, scar tissue, edema, mental conditions,
Yeah.
psychiatric issues, depression, anxiety. So if it's my understanding is correct, essentially what's happening is the light energy is specifically activating the mitochondria in your cells, and every cell has mitochondria. So what you're doing is making those little workhorses of your body's cells more active, more efficient, and better able to produce energy to do their job. So if their job is to fight disease, they're doing it better. If their job is to improve scars, they're doing it better. And if it's to, affect your neurologic system and your cognitive performance, then they're more capable of doing that because your cell has more energy. Is that kind of what's happening?
That's spot on. The photons reach the mitochondria, increase the ATP, which probably means nothing to, the general audience, and in turn creates an energy.
Yeah.
Right.
Needs your energy.
So quickly heal and do whatever it needs to do.
Whatever it needs to do. And so it's not really selective, but it's allowing your body's innate cell structure to perform better.
Exactly.
Right?
Yeah.
Is that kind of like what red light therapy does?
It's the same.
It's the same
concept. It's all photons and mitochondria. So photosynthesis, essentially just like a plant for humans.
Mm-hmm. So. How long does it take to see results? Because I tried red light therapy a couple of times, and I'm sure it's something that you don't see good progress with unless it's done over a period of time.
Yeah, that's the hard part about PBM, and I think that's why it hasn't really taken off, is because it takes several treatments and then a maintenance dose. So I'd say about 10 treatments to get to where you need to be, and then maintain maybe twice a week. That's 10 treatments every single day.
Now, my only experience when you treated me once, I hurt my back, if you remember that.
Yeah, you're a surgeon.
Yeah.
A lot.
And I somehow tweaked my back and threw it out. And, I'm really lucky to be affiliated with great providers over at the spa. So I had a massage and that helped work things out. But still with pain there, you said, let's try the photobiomodulation. And it was just like 5 minutes.
Yeah, it didn't take.
And I honestly think that it made a big difference. I don't know if it was a long-term difference or not, because after about a day, most of my pain went away. So it could be that that's all that it took, or it could be that it was on the, healing end already. But I was impressed by how just a 5-minute treatment can help so dramatically with pain. And I could imagine if you have a chronic problem that it would just recur, and then you have to treat it again. And then over time, it gets less and less intense to where maybe you've totally eradicated that source of pain. Are you using that a lot in your daily practice?
I actually am. I'm so glad that you had that experience so that you can communicate that to people, because like you said, it's really hard to believe. It just sounds like a fantasy, like, oh, you flash a light and there's no pain or heat, and then you just go home and everything's great. But essentially, that's what it is. Yes, it takes a lot of treatments, but you will find relief straight away. I do have a lot of post-op patients, not specifically from you, but other places where they've struggled and they couldn't find help for the pain a year, 2 years, 3 years after, that have marked improvement and are so thankful for that treatment.
Yeah. Most of my surgical patients don't have anything.
They don't suffer. I don't have, honestly, I don't have, any fear
like
post-op
things that aren't terribly painful.
Right.
Some things maybe.
But there's a lot of
things, sure. Orthopedic maybe, and general surgery things.
Got people coming an hour and a half for photobiomodulation.
Wow.
Yeah.
That's awesome.
Super proud of that.
Would getting like a home red light therapy device be any good, or are they just not the same quality, or is it worth trying if you're someone who needs it like every day?
I mean, they're coming up with a home device. I really think it's beneficial, but there is such thing as overuse too, and that would actually reverse the effects, and it would cause a worse problem. That is a thing. And so I do think it would be best that a provider perform that, but they are coming up with a home device.
I mean, that makes sense. It's kind of like too much of anything is harmful.
Absolutely.
Even pharmaceuticals, you don't want to take like 10 times the recommended dose. And I was going to ask you also about the armed services, because they all use, and to some degree, photobiomodulation. And I know that that's something that's really important to you as a veteran, is treating veterans and some of the work that you've done. Maybe you can send me that picture where you got an award, and I can show it to the audience. But what was that? Tell us about that award and how it links with your work in aesthetics.
Sure. So photobiomodulation actually was used from the British Army and Navy before we used it here in the United States through the Department of Veteran Affairs. Boston actually has a PBM helmet that they use for post-traumatic stress patients, and they have a great result.
Could it make your hair grow back?
It can, actually. Supposedly. I know. I haven't not studied that, but I am curious to know. But yes, supposedly it does.
Yeah, but it helps with stress disorders.
Yes, sir. Yep. And so before I came to North Carolina, I was definitely involved in a lot of politics for veterans' cause, primarily because I can relate to that. And I did a lot of volunteer work with the 22, which is 22 a day, is a suicide or prevention for military, especially our PTSD. PTSD isn't the only cause of suicide in veterans, but it's a big problem. And so I invested a lot of my free time, which was minimal, to volunteering to raise money for that cause. Also for the Wounded Warrior Project. In that, I did that through the American Legion. That was my platform, and the Veterans of Foreign War. I belong to both of those groups. I met a Marine called Terry Sharp, and he's the walking Marine. So that's his thing, and he walks from North Carolina to DC and back again.
Oh wow!
He's in his 70s.
Wow!
So when he's
like a Forrest Gump kind of.
He really. I can't wait for him to hear that. But yeah, he's amazing. He's inspirational. And he said, I'm really proud of the work that you've done, and I'm super excited, about how passionate you are about veterans' cause like I am. How about you come with me to the White House? And I said, absolutely. He said, I think you deserve to be there as much as I. So I said, oh my God, it would be an honor or privilege.
Wow.
And I received an award from Karen Pence, which was the second lady at that time. And then Trump. President Trump. Yep.
Wow.
At the White House while he was still active.
That's awesome.
So it was incredible. And I was
an honor to be recognized for what you're trying to do to help.
Oh, yes.
Serve for us.
And I was able to bring my son along for that journey too. He got to accompany us. So, I mean,
cool.
How fantastic.
That's really amazing.
Yeah.
And so we know kind of what you're doing now. What are your thoughts for the future? Are you looking to pretty much do this until you die, or are you looking to...
I know.
You're not going to be retiring anytime soon.
No.
But what kind of ideas or plans or ways do you see what you do change with the changes in the industry, or what are your thoughts on that? Anything?
I hope that the industry changes. I feel like, to be honest, lasers are like cell phones. It's the same cell phone. It's just a little bit more bells and whistles. It seems like it's been the same modality. If you understand lasers, it's the same concept each time. It's just reinvented a little bit from each company for marketing purposes.
Right.
And so that's a great question. I would love to see.
It's time for some major shift.
Yeah, I really do. I do. Honestly, there's something missing, but I would like to further the photobiomodulation along. That's the goal.
Do you know much about AI?
It's funny. I use an AI app every day.
Like ChatGPT or something?
I do, because my son is in the mechatronics engineering program at Virginia Tech, and his father is also an engineer. He was for NASA for 12 years. So they're really hip on this stuff, and they keep me in the know.
Well, it's interesting. I really like it, learning about that, and I think without a doubt, AI, and people who I've talked to recently are going to be like, "Oh, here he goes again with AI," but it's going to revolutionize our world.
Oh yeah, it's fascinating.
It's fast happening. It's going to be within a decade. I think that every industry is majorly going to feel the effects of a new technology, in particular. The artificial intelligence world. But for me, anytime there's a topic that comes up, I'm thinking, how's AI going to play into this? And for sure with lasers, when you said we need something new, a big shift,
Yeah.
without a doubt, even just diagnosing a patient's skin and learning what laser, what settings, what frequencies, what pulse durations are going to be ideal for that particular area of the skin right then and there is not at all far-fetched. I mean, that could be done within a year probably. So it might take some of the guesswork out, which is good. It doesn't mean that you're going to be useless and you're going to be, kicked to the curb, Nadine, and we're going to be using the robot to do all of our lasers, because there's going to be some deeper understanding, of aesthetics and artistry and all that. But it might make your job easier, or maybe safer, or maybe a little bit more exciting because you can push the envelope more if you have the help of some machines.
It's funny that you say that, because I regularly use an app called Nova, which is an AI app. And if I have a question or I'm doubting myself, I'll type the question in there and it gives me exactly what I need.
Wow.
It's true. I use it as a tool every day almost. So
that's awesome.
Yeah, it's great.
So we need better technology.
Yeah.
And that's going to happen inevitably, but we need people who are working on it instead of just trying to stick with the status quo, right?
Working on my son on that one.
Yeah.
The engineer, come on. With laser.
And is he interested?
He's more interested in entertainment.
Oh, cool.
Like apps and games and cell phones. But he actually works already for a company called Mantech, and he's learning their process. Actually, he's helping them build their AI system. Really? For that company. So as an extern, and he's part of a group of externs who are working on their particular AI system just for that company. So I think that's fascinating. So you're spot on about AI. Yeah. It's happening already.
Absolutely.
Yeah.
One thing I would like to ask you before you go today, because this is the Beauty Calls podcast, as you see, and it's not always about beauty, but beauty touches on so many different arenas, even athletics and literature, obviously everything, art, and our human form. So what would you say is your definition of beauty as an esthetician? Because basically that's what your job is. You're a beauty expert, right? You study aesthetics.
Apparently.
So what you probably the best suited one to tell us definitively once and for all, what is beauty?
Wow. No pressure.
You can do it. But honestly, what are your thoughts on that? Because of course I asked you beforehand, like I ask every guest, and I have an idea of what your answer was, but please share with us if you can.
So you did ask me before, and I gave you an answer. And I think it's a twofold question. I mean, essentially, beauty at its core, like we talked about, is primal, right? We all have this innate thing to have to analyze and say, yeah, that's beautiful,
right? For
the purpose of procreation, right? And to create healthy people and continue our
absolutely
our beings, right?
Right.
But then once you humanize it, right, you become, because animals, peacocks are a good example. They'll peacock their feathers to get that female peacock in and reproduce. But humans are different. It's primal first and then human second, in my opinion. And that goes to the internal. What are you projecting at external? And I am going to reference the Bible. I know that not everyone's Christian, but that's okay. It's the most popular book out there, right?
Sure.
And in Peter, it says that the internal is what's beautiful. That's what's supposed to be beautiful, right? And for me, what's beautiful is how we serve each other. We all serve each other. Everyone serves each other, whether you think so or not. We're all getting paid to do a service. And it's all for us. It's all to support ourselves, good and bad. And so the way you serve humans or people, to me, is beautiful. That's what defines beauty. How you serve others and the attitude you do it with, if it's unconditional, to me is beautiful. You can project that. So I'm going to use as an example our nail techs. They do pedicures. Jesus cleaned feet.
Mm-hmm.
They're serving, right? I'm not comparing our nail techs to Jesus, but they're serving. Our estheticians, they sit in a dark room every day, all day. They don't see the light of day except for when they take that next person back. For me, that's serving. That's hard. Our massage therapists, they give of themselves, their bodies. They're really trying hard to make that person feel better, and they're giving of themselves.
And Daniel, he's got the hair.
He does. I mean, he's got the look.
He's got the Jesus
Great.
hair.
That's a great new song, by the way. Myself, unfortunately, I produce pain to people mostly every day, all day. And that process is not easy. It's not easy to get that person through that process. But that's in my beauty. My beauty is to get them through that process.
It requires that pain in order for you to serve them well.
Exactly.
And you're doing it with a noble purpose, right?
Right. And you, in a room, 40 surgeries a week. One, I don't know how you do it. Two, you're back, you're standing, you're hunched over. You're giving of yourself. I mean, and it's hard. Your staff right there with you.
Yeah.
The receptionist, really trying to balance everyone's schedules, patients, us as providers, they're giving in that way. So for me, it's a privilege to be a part of that community, to give. And for me, honestly, this whole thing is beauty. It's not just aesthetic for me, it's the whole process. I think it's just beautiful.
Yeah, there's a lot of layers to beauty, and there's a lot of layers to, just like there are to individuals.
Yeah.
So you can't just pinpoint one thing. It comes from the inside and the outside. And I think understanding that is important for each person, because we can only do so much to help with one layer.
Right.
And there's other people out there who are specializing in other layers, but you need to know for yourself, if you want to be a beautiful person, if that's a goal of yours, which I think it should be for everyone, because essentially what it means is you're a good person.
Exactly.
Then what layers, what elements are you going to need to develop? And if the problem is inside, then, you and I can't do a whole lot to help.
No. And there's often times where there's just unpleasable patients, and you've had them. And so have I, where you try so hard for that person, and it's really disappointing, but it's more sad. It's sad. And I usually see a beauty in everyone and everything, but in that situation for me, I'm not going to lie, it's tough. It's tough to see that.
Absolutely.
In that individual.
And I don't understand what you're saying from a relational standpoint, but how about I'm looking outside the windows now and I see a beautiful sky and beautiful green trees, and that has nothing to do with service of anything.
No.
It's just, it looks beautiful.
Well,
why is that? What makes it look beautiful? Why is it that if it didn't look like it does right now, I might say it looks ugly outside?
Right.
There's no value attached to it morally. It's not that, green trees swaying in the wind are good. You know what I mean?
No, right. But I think it goes back to that primal thing where, we recognize, it's deep-seated in us to recognize something that's beautiful, or and we probably think the sky is beautiful when it's blue because, who knows, maybe it's a deep thing where, it's feeding the plants and everything's happy and great and it's easy. If it's raining outside, it's not easy, so that's really kind of feels gross, and it's not beautiful because it's not easy or for our living, I guess.
Unless you're a farmer, then I guess you're
fantastic.
You think
it's all perspective,
right? It's in the eye of the beholder.
Absolutely.
Yep.
Absolutely.
And I think that's pretty much the best way to sum it up. We all have our own definition, and we're seeking on this show to talk to experts like you who deal with it every day and trying to help people attain their own beauty. And I really appreciate you coming by to talk.
Hey, thanks for having me.
And for being a very valuable member of our team and someone who we can trust to participate in the care of all of our patients here at the Aesthetic Center.
I appreciate you so much.
Thanks.
Truly.
And when we get some new lasers that are even better than the ones we have today, we'll have you come back to talk about those.
Awesome.
And AI.
Ain't no call like a